I know that we've talked probably more so about new grads and current students than we have about clinicians with years of experience. So just want to share with you kind of a synopsis of a call that I just did with somebody who has been in the clinic for 20 years, has been through the shift, and just talking about sticking points and what they need to work on. They're going to come back and redo lab weekend, which is typical. I think it's been over like a year and a half since they've been in lab weekend, and they still have some little things that they feel like they're missing. And that I'm going to get to the take-home message for them here in a second. So what I need you guys to understand, if you have not been in the shift, gone through the shift, or are currently in the shift, is this is not a weekend-long CEU course that you just come in and I just give you a bunch of stuff, you memorize it, and you go out and it works. Or like most of the time, you memorize it, you go out in the clinic, and you forget to do it because you fall back into bad habits that you're doing before, because a typical CEU course does not teach you how to reinvent your thought processes and your skill set. So remember, this is taking everything that you learned, taking it apart, having you hold it up and say, now, does this really work? And can I explain why this works? And oh yeah, the definition of work isn't patients feel better, isn't range of motion increases for a while, isn't swelling decreases. That's not works, okay? So the definition of works, being successful with a patient, is they come in, don't know what the root cause of their problem is. They know they can't do certain things. They want to go back to doing those certain things. So work, the definition of what you're doing works, is they go back to doing what they want to do. They're not thinking about what they want to do because you gave them a bunch of verbal cues. That's not work. They're not still using symptom modification gimmicks as they're doing what they're doing. So they're not in orthotics. They're not wearing a brace. They're not wearing K-tape. They're not changing what they're doing. They're not working around the symptoms. They're actually fully functional without thinking about what they're doing, without changing anything that they're doing, without wearing any special gimmick or gadget. And they go back to doing what they want to do without limitation, in minimal amounts of visits. So being successful as a physical therapist doesn't mean you see somebody 2 to 3 times a week for 6 to 8 weeks and they finally start getting over the hump. That's wasting people's time, okay? So when you go through the 180 system, our chief goal, because if we don't get this chief goal done, then we can't get anything else done later on down the road. So the chief goal is to give you a thought process that you can relate everything to, that you can build everything off of. So if we never change your thinking, which is what a conventional CEU course does. So when you go get cupping certified, needling certified, FMSA, FMSO, whatever the hell it is, certified, are they teaching you how to take apart your thinking, hold it up to a certain standard and say, how does this work? Does this work? What does this have to do with physiology? Can I critically think around this so when I do have a curveball patient, I don't have to get knocked off of I'm not put back. I actually say, yeah, I can figure this out because I have a thought process. So the first thing you have to do is change your thought process. Once you do that, now you have the ability to navigate the difficult patient. If I just gave you a bunch of gimmicks and didn't teach you why you're doing them and how they work and how they relate to anatomy, physiology, biomechanics, then you can't think through anything when the patient doesn't do what they're supposed to do. Okay, so the first thing we have to do is teach you how to think. Then we have to teach you how to use treatment strategies based on the thought process that you just came up with. Okay? So this is why it's hard for physical therapists, chiropractors, massage therapists, athletic trainers, whoever, whatever kind of clinical setting that you work in. If you've got more than 5 years of experience, and if you've definitely got more than 15 or 20 years of experience, this is why it's hard. So when I just talked to this guy, he's got over 20 years of experience. So we have to unwind 20 years of experience, to get him to change what he's doing. Now, it's not hard for him to believe in what he's doing. Like, I give him the information. He's like, yep, I get it. I'm all in. That makes total sense. So it's not that it doesn't make sense. It's that once we give him those treatments, those thought processes, and send him back to the clinic where he's working with 5 conventional PTs, PTAs that do everything the way that he's been doing things, what's his tendency going to be? His tendency is going to be, I fall back on what I'm used to, and I have all these people that are around me doing the same thing that I used to do. So it gets really easy. Just like if you're trying to stop smoking. If you're trying to stop smoking and you go to a bar where everybody's smoking, what do you think you end up doing? You start smoking, even though you know smoking is bad. It's just the way it works. Okay? So that's why it's imperative to start learning these things before you get more experience. Okay? So what I was talking to him about is, understand this. The bar for physical therapy has been set so low that your patients aren't really expecting all that much out of it. Okay? The bar has been set to the point where people are supposed to feel better after 2 to 3 visits a week for 6 to 8 weeks and think of, well, I'm starting to get over the hump now. And as long as I wear my orthotics, and as long as I put my K-tape on, and as long as I do my stretching, and as long as I do this, and as long as I use that, then I kind of sort of feel better for a little bit. That's where the bar is for physical therapy. It's way down here. So, as we've already talked about, if you get rid of the things in your toolbox that those people are using and they've been given those things by their physician, physical therapist, chiropractor, whatever. So get that crap out. Tell them stop stretching, rolling, massaging, inserts, all that crap. If you just take that crap out of there and you just sit there and have a conversation with them for an hour, they're already going to get more results than they did at the other place. So you've taken out the things that are actually making them worse. Okay, now they're just going to be the same. Now, if you can add something that increases the neuromuscular function, which is the root cause of their problem, you're addressing the root cause. What I told this guy is, if you're able to use 60% of what you learned in lab weekend, you're going to get phenomenal results. It might not be the results that you're seeing me get because I've been doing this forever. Okay, so my results are up here. Remember, the bar for physical therapy is down here. So if you get rid of the crap they've already been doing, you're already there. If you add getting to root cause, 60% of what you're going to learn in the lab weekend, now you're here. Patients think you're phenomenal because this is all they expected. You got them here in 1 to 2 visits. You're a magician. You're the magic guy. You're the lady who does stuff that nobody else can do. You've already won, even though you're only doing 60% of what you're learning in the shift and lab weekend. Sound like a win? That sounds like a win to me. And oh, by the way, you're getting them here in 1 to 2 visits. All right? And you're doing this in half an hour. You're not spending an hour with them 2 to 3 times a week. Okay? So our goal is to get you here. But if you're here in 4 months and all they expect is this, you're the person that walks on water and they're going to follow you wherever you go. Okay? So understand, this is a thinking strategy first and foremost. Then we're adding treatment and assessment and patient education and exercise and all that stuff on top of the thinking chain, the differences in thinking that you're going to be using, and critical thinking and root cause analysis. Okay? So the faster you get that stuff in your head, the less you're frustrated like the PTs that have been doing it for 20 years. We don't have to break all those bad habits. We don't have to pull you out of smoking. You already know smoking's bad. You don't want to do that. So it's really easy. We're already past that. Okay. You took all the bad stuff out of your toolbox, like we talked about in the 3-day challenge. So you're already gone from here to here. Once you get to lab weekend, you'll get to there. Once you practice that stuff and get more reps and more practice saying what you're saying and educating the way you're educating, and then you come back and do lab weekend again, now you're here. And remember, patients only expect this. Physicians only expect this. When my post-op patients go back for their post-op visits, They always come back the visit after they see their physician and they say, my physician was blown away. They don't understand how I have this much range of motion after a major rotator cuff repair and I'm only 6 weeks out and I already have full range of motion. Because this is all they expect. Okay, same thing for ACLs, same thing for total hips, total knees, all that stuff. They come back and they say, my physician says I'm way ahead of schedule. They're really happy with what you're doing. Fantastic. All I'm doing is fixing your problem. Okay, so keep that in mind. So if you are frustrated and you're out there for 15, 20 years, you're frustrated because that's the way the system works. It's just that most people gave up a long time ago when you chose to stick in it. Now, once we take the bad stuff out, give you some good stuff, you practice the good stuff more, now you're up here where you should have been the day that you walked out of your grad school. All right? So if you got questions, comments, post them below. I'll talk to you guys later.